Hey everyone. I think anyone that's going for IVF, there's a big knowledge gap. And part of the reason for that is because when you're dealing with infertility, that process can go very quickly where the type of treatment that's being recommended can escalate right directly to in vitro fertilization. I know some patients have the benefit of being able to decide whether they want to pursue IVF over a period of time. A lot of patients are thrown into it because they don't really have many other options. And as great as IVF is, the success rate in Canada for IVF is overall still fairly low. And certain papers have quoted anywhere from 14 to 15% up to 35% success rates for something like IVF, which considering, it's a procedure that can cost upwards of 20 grand and we only get one funded cycle here in Ontario. There's a lot riding on that IVF cycle, and any other IVF cycle pay for individually, so privately funded IVFs. And so we have to ask the question, what can be done to improve your success rate with something like IVF? And I think for a lot of patients, they're not aware that there are changes they can make, there are treatments that can help support their success rate with something like IVF. And sometimes it's almost like it's too good to be true because some of these micronutrients we've been using for a lot of patients going for infertility treatments, we saw in early trials and early studies how significant of an impact they had on success rate. And something I always advocated for, right from the beginning when we started working with patients, that were going for IVF or dealing with infertility and they were trying naturally, or even with IUI. We started that years ago. And so one particular micronutrient that's always been a personal favorite for me that I prescribe to a lot of patients is coenzyme Q10, CoQ10. And back years ago, we had early research showing that patients who took CoQ10 before an IVF and during an IVF, they saw a decrease in something called aneuploidy rates. Aneuploidy rates are where basically there's an imbalance in the chromosomal distribution during the growth of that follicle or the egg. And when you go for IVF with the aneuploidy, if there is aneuploidy, it basically leads to a non-viable embryo. It can lead to a non-viable pregnancy. So we see that the aneuploidy rates go down with something like IVF when we use a simple supplement like coenzyme Q10. And then over the years, we saw better research. Like in 2017, they published a Cochrane review, which the Cochrane database is a very high quality, rigorous, systematic review and meta-analysis. And they looked at a lot of the micronutrients used for infertility in different research trials over the years. And one of the main ones they looked at was coenzyme Q10. And what they concluded was that using coenzyme Q10 increased the likelihood of a couple to conceive by almost 2 times. So if we have two couples of the same age, same condition, and one uses CoQ10 for the female partner to help support egg quality, they're twice as likely to have a positive pregnancy compared to the other couple that didn't. And just recently, this year, there was a new research paper published, and it looked at specifically how does CoQ10 supplementation improve success rates specifically with IVF? And they looked at multiple trials, and the results to me were shocking, but also not surprising. And what they concluded was that if a couple takes coenzyme Q10 before an IVF procedure, they were 2.5 times more likely to conceive with IVF compared to the couple that didn't. And so, on average, the couple that didn't, their average clinical pregnancy rate was somewhere around 14%. And simply adding CoQ10 to the prenatal period in preparation for the IVF, that group or that subgroup of patients, their average success rate or clinical pregnancy rate was around 28%. So about double. And for me, that's, to me, it's so impressive how simple micronutrients like coenzyme Q10 can have such a gigantic impact on our chances of conception. And so think about all the couples that have gone for multiple IVFs, have to do more than one, sometimes three, and sometimes we see up to even 4 or 5. I think the largest number I've seen a patient do is about 10 IVFs over many years. And when we're not seeing success, it's like when we can include something like coenzyme Q10, we should ask ourselves if our chance of succeeding is almost a double or more. Could we have prevented the need for so many procedures, so many rounds of IVF? And with in vitro fertilization, the biggest factor you can modify to improve your chances of success is the quality of those eggs and the quality of the embryos. Because the higher quality embryos you have, we know that we have a greater likelihood of having, embryos to freeze, to do frozen embryo transfers down the road. And so if you get multiple follicles or eggs with an IVF, but they're poor quality, a lot of them don't make it or are not, we can't freeze them. So we can't use them down the road for a frozen embryo transfer, which is a much easier procedure than having to do a fresh round of IVF. And then plus for that fresh round of IVF, if you have a better quality embryo, we know the chances of pregnancy are usually higher as well. And so coenzyme Q10 has a very, potent role with that. And especially in patients above the age of 35, we know that the concentration of coenzyme Q10 in the ovaries and the follicles starts to go down. And it's actually implicated as one of the reasons why we may actually see a decline in egg quality with aging in the early stages, so 35 to 40, and why why something like coenzyme Q10, if we supplement with it, may actually improve the quality of those embryos. So it's really important when you're preparing for an IVF to know that it's not just whatever stats are given to you. In many cases, there's a lot of modifiable risk factors, changes you can be making to your lifestyle, to your diet, to the micronutrients, to the prenatal, to your vitamin D status, additional blood work, which checks for additional, antibodies or autoimmune conditions, which can potentially impact your success rate or miscarriage rate. And so coenzyme Q10 is one of those simple things we've been using for years, but it's just encouraging to see, more and more research about these nutrients and micronutrients on how they can have such a significant impact. So if you're dealing with infertility and you're thinking of either trying naturally an IUI or doing some procedure like IVF, which is, has been life-changing for a lot of patients to be able to do IVF and have a much better shot at conception. Something like coenzyme Q10 might help in making that journey that much easier. So it's really important to work with a qualified healthcare provider, wherever you are, someone who's confident and well-versed and well-informed about this research. And a lot of time we spend, time educating patients, sharing that research, and in many cases sharing that research with the physicians as well. And why we're recommending what we're recommending and what the clinical research behind that recommendation is. And so it's important to, share that information with the healthcare provider always, but the most important component of a fertility journey and treatment is always you. And it's important you understand, what can be done, what can be changed, and what you can be doing to help empower yourself, help improve your chances of having a successful pregnancy. Because coenzyme Q10 is the tip of the iceberg, and there's so much more that can also be done. But even just using CoQ10, we see in these trials can have such a significant impact. So it's important to know that with this fertility process, a lot of times patients feel like they don't have any power in what they can or cannot do. And our role is to share with patients through these informative videos, our research blog posts, through seeing patients with video consultations on, here are all the things that you actually can be doing and have been shown and proven to improve our chances of success. And we discuss also the limitations on that research and what the benefits are and what the risks are. And for something like coenzyme Q10, the risks are minimal. We always check for, different medications. Sometimes it can interact with some prescription meds. So in those cases, we don't recommend CoQ10. But in general, it seems to have a very high safety profile. And something simple like that, might double your chances of success with IVF.